is Joseph Chebe. I am an SEO and content strategist here at My One Health, and I will be your host for today. So I would like to welcome everyone, all our attendees here in Kenya, Turkey, Dubai, and all other parts of the world. And I also like to give a warm welcome to all our partners from referral, our insurance partners, and all my colleagues joining in uh, at My One Health. So a little bit of a rundown of the program. Um, our agenda for today is stroke prevention, recognition, and recovery. So what we want to know, and Professor will tell us, is the key risk factors and how we can reduce stroke, what to do in the first critical moments when someone suffers a stroke, and a few examples uh, from early action to full recovery and the modern treatment options available today, and especially from our facilitator and our partner hospital, which is Liv Hospital. So this session will take approximately 1 hour to deliver, and yeah, it shouldn't be so long. I'm sure most of our participants will have a lot of questions. So what you can do is you can just go into the chat section and drop in your question to our professor for the day, and then he will be able to answer all your questions. Yeah, and I guess that's more or less like it. Um, please be open to learn. And yeah, so Eva, maybe you can take over.
Thank you so much, Chebe. And hello, everyone. Thank you once again for joining our session today. And we promise that it's going to be an informative session. We are going to learn a lot from the professor today. So just I'd like us to maybe go a bit about My One Health, just a bit, and then we'll hand it over to the professor. So a brief history, and before then, maybe I can introduce myself. My name is Eva Mutuku. I am the product manager for My One Health, and I'm happy to have you here and to take you through today's session together with Chebe. So about My One Health, it was founded in 2018, and the main thing that we do here is medical facilitation, and especially for specialized healthcare around the whole world. And we have a vision to provide better and more convenient access to specialized healthcare for patients around the world. So far, since we began, we've assisted over 50,000 patients from just about every country worldwide. We have more than 350 top-tier hospitals that we are working with. We also work with insurance, and we have 14 insurance partnerships around the whole world. And when we look at some of the services that we provide, we offer end-to-end patient coordination. So in case a patient is not feeling well and they would like to travel to another country, we help them to look for a hospital. We get them the treatment plans from the hospitals, and we also facilitate the travel, the coordination, and anything that they may need from our facilities. Not only that, but we also carry out post-treatment follow-up. So in the case where this patient has gone back to their country, we will assist them in making sure that they get continuity of care. We'll do follow-up appointments with them. And we also make sure that any payments between us and the hospitals are readily available, and the patient can get the best care that they need. So for today, I will hand over to Chebe so that we don't waste much of the time, so that he can introduce the hospital, Liv Hospital, as well as let us know a bit more about the speaker that we have for today. Chebe?
Thank you so much, Eva, for that. Liv Hospital is based in Istanbul, Turkey, which is a JCI accredited medical institution. So JCI is one of the most stringent vettings of hospitals around the world, and Liv Hospital has that. They have various centers of excellence, including cardiology, orthopedics, pediatrics, and cancer care. But for today, we'll have one of the biggest and the best experts in the world in neurology. And Liv Hospital also has one of the best neurological centers of excellence in the world. Our expert for today is Professor Ayhan Öztürk, who is a distinguished neurologist. He has a he's a specialist in neurology, but with a subspecialty in clinical neurophysiology. He has over 25 years of experience as a medical practitioner and has particular interests in diseases that affect various people, especially in terms of neurology. Professor Ayhan Öztürk holds a board of medical specialization in clinical neurophysiology, which he obtained in 2011. I assure you guys that we have the best of the best in the world. When I say we have a world-class expert, I mean exactly that. Professor Ayhan, welcome very much, and thank you so much for agreeing to take this on. Kindly, before you start your session and inform us about stroke prevention, recognition, and recovery, maybe you can tell us something about yourself, maybe who you are, something a little bit personal, and then you can jump in right into your section. Sorry, Professor, your mic is on mute. Good. Now it's open.
Yes. Thank you very much for your kindly introducing. I am Ayhan Öztürk. I'm a specialist in neurology in Istanbul in Liv Hospital. I will show you us everywhere, every person in a stroke and what to need to know the patient. Here are the outlines. We are the learn about the human brain, what's the stroke, and how common in stroke, and stroke facts, type of stroke, and how stroke can affect us, our body, and the stroke risk factors today. The human brain is the central organ of the human nervous system, and it both motor and sensory function throughout your body and help you receive interpret information from your senses. Also responsible for thinking, remembering, and understanding the brain. Uh, it's small size brain. Our brain is small size, but it's the most complex organ in our body, made up of millions of neurons, and it reaches maximum size by 18 years of age. Stroke is disease that affect the vessel of the brain and also venous vessel and arterial vessel in the brain. Affected part of the brain doesn't get oxygen and nutrition it needs because of the brain need the oxygen and the glucose. It doesn't full of charge and it needed on time oxygen. Brain injury from stroke can affect any of the following function: ability to move, feel, think, and behave. A stroke is medical emergency because the time is brain and as well as fast for the treatment for the stroke. Stroke is the brain attack, although stroke is more common after age 55. It can also happen any age and any time, but it's more than half of the patient in the middle age. Leading cause of adult disability. Some people who have a stroke will make a full recovery, but two or third of patient have disability. Every 40 seconds, someone in US, sorry about the statistical because of the United States is the wide range of the statistical. Every 40 seconds, someone in the US has a stroke. 2 million brain cells die in every minute during stroke. How common? Stroke has a large impact on society. More than 9 million stroke survivors in US and about 55 thousand more women than men. Every year, about 1 million people US in stroke, and some of them the recurrent stroke. Black people are twice as likely as white people to have a first-time stroke.
Sorry,
Stroke
Professor.
is
Sorry for interrupting you, but the slides are not moving. Your
okay.
slides, yeah, your PPT slides are not moving.
Sorry. Stroke is the fifth leading cause of death in the US, and treatment may reduce effect of stroke. But we don't forget up to 80% of stroke may be prevented with lifestyle changes. Sorry, do you have any question?
No questions at the moment. Yeah, just that your slides aren't moving along with what you're saying, but it's okay.
Okay.
We can move forward.
Okay.
Yeah.
Yes, it's the some of type of stroke is the one and very widely of ischemic stroke is the most common type, account for 87% strokes. It's ischemic stroke in the when a clot block the vessel supplying, the artery becomes narrowed or clogged with this. The second one, hemorrhagic stroke, is the blood rupture, and the blood is outside of the vessel. And however, they associate with a higher risk of death. It's compared to ischemic stroke. The other types of stroke, transient ischemic attack, and it's a temporary blockage. It's the 1 hour and the 24 hours is the symptoms come from the normal in the 1 hours. We we see that some people with stroke warning sign is the meaning for fast face. Does one side of the face drop or it's numb as the person smile? Is the person smile uneven? The A arms is one arm weak or numb? Ask the person raise both arms. Does one arm drift downward before? And the S speech. Ask the person to repeat a simple phrase. Is their speech slurred or strange? And the T time. I before the said the time is brain. If you observe any of these signs, call emergency immediately because a lot of treatment of the stroke in the 3 or 4 hours inside is making in 3 hours. The other symptoms, numbness or weakness, confusion, and trouble seeing, trouble walking, and severe headache, especially severe headache with the hemorrhagic stroke. Act quickly. If you experience one or more of these symptoms or notice them in someone as in short time, call emergency and the patient go to a hospital. And some treatment is very invasive in the like a thrombectomy or thrombolysis. It's happen in a hospital. The effect stroke depend on various factors. One of these factors, region of the brain that is affected, size of the area, and function that the major area controls. How we can learn this? Stroke can affect if the stroke on the left side of the brain affect the right side of the body. Weakness, speechless, and inability of read, slowing behavioral style, and reduced ability to math, memory loss. And the stroke is the right side of the brain. affect the left side of the body, and you may experience some difficulties with also weakness, depth of perception, vision problem, and inability to paint and music. Some of art problem. Its conclusion, the effect of the right side of the brain. What's the risk factor for stroke? Some of the risk factor cannot be controlled. For example, age. Some of the middle age, the higher risk. The other cannot be controlled under our control, family history and the genetic factors. And the other uncontrolled risk factors, race and ethnicity. Some black people, for example, is the more higher than the other people, the stroke risk. And the other gender, women have a lower risk, but it's until the menopause. But after the menopause, it's equally men and women. Prior stroke or trans-ischemic attack is the higher risk of the future stroke patient. Medical risk factors that we limited change this. For example, high blood pressure, if you control it sensitively, because the risk very low. The other diabetes, having diabetes more than doubles your risk of stroke. Also, the other cholesterol level of the body, anti-circulation problem, and some of the cardiac rhythm problem. Of course, atrial fibrillation is the risk of stroke. We can change the lifestyle and reduce the risk factors. For example, quit the tobacco and smoking, or vaping. Nowadays is the very use vaping and to stop the smoking. Eliminate or reduce alcohol use and lose of weight and change the obesity, increase the physical activity, and eat an healthy diet.
Hello, Professor.
Yes?
Just a minute. Your slides have not been moving through the session. We can see the progression of the
I will
presentation.
change, but there is different. It
Okay.
is now?
Not yet. Yes, now they are good.
Okay. You see the slides? No? Okay. How can diagnose the stroke? In case of stroke, diagnosis will help type of stroke, a lot of blood tests or CT scan or MRI scan. It making quickly. But it's important of this the lecture, life essential aid. How can we change our risk factors in stroke? The one of them is eat better. Aim for overall healthy eating, whole foods, fruits and vegetables, and the Mediterranean feedings such as olive and olive oil tüketimi produces, and the lean protein, nuts and seeds is very good for protected stroke. Be more active, daily 1 or 2 hours, and walking or jogging, it's very good for us. Quit tobacco also I will say. It's the more important things is get healthy sleep. At least 7 or 9 hours we have to sleep in adequate sleep promotes the healing. The other hands manage weight and control the cholesterol level. Also, blood sugar level is very important, and blood pressure measurement and control it. It's very important for the protect the stroke. The other healthier and reduce your risk factors. Take your medication for hypertension or other the cardiac problems. Reduce the stress with the sport or like physical activity. Have a radical medical checkups. And the highlight of this lecture, despite it's the small size of the brain, is the most complex organ. Stroke can affect any of the following function: ability to move, feel, think, and behave and speak, leading cause of adult disability, and first sign, face, arm, and the warning signs. Time is of great importance. Is that as soon as possible is controlled in the hospital, risk factors that can be controlled or can't control it. Life Essential Aid is your checklist of lifelong good health. Thank you very much. If you have any question, I will answer for this.
Thank you very much, Professor. There was a little bit of a problem with the slides, but I hope everyone has listened in, and we apologize for that technical hitch. Now you guys can send in your questions through the fireside chat, and then we can be able to present them to the professor. But we have the first question, which is, Professor, how will someone maybe not tell exactly, but what are some of the biggest indications of somebody who's about to have a stroke, maybe in a few days or a few weeks to a stroke? What are some of the things that maybe someone will be like, someone will see that this person could potentially get a stroke?
Most of the stroke treatment have to start it in the 3 or 4 hours but is the 1 week later or 2 days later is the very rare treatment, and after that it's just a physical treatment.
Okay, thank you. Are there any maybe lifestyle habits that could contribute to stroke? And if so, what can we do to maybe prevent that in terms of lifestyle?
Lifestyle changing is very important because after the stroke is very limited for the treatment. But it's the important that there is no stroke, there is no live stroke. Because of this, we change the lifestyle. We get a sport and we get a healthy eat. And the most important thing, in my opinion, to me, is the first important thing is the good sleeping. Actually, is last research, some research is show us the worst sleep quality. It's related to stroke, of the ischemic stroke, especially because of this. We get a good sleep.
Okay, so for those of us who don't get enough sleep, please make a point of having some sleep. Professor, if I have atrial fibrillation, should I be worried about getting a stroke?
Yes, it's very important thing for the cardiac rhythm problem in the stroke. In the first of them is the atrial fibrillation. If we have the atrial fibrillation, we use some anticoagulant drug for the blood viscosity, low the blood viscosity.
So someone should attend hospital if they figure out they have atrial fibrillation just to prevent the stroke?
Sorry.
Um, in connection to atrial fibrillation, so should someone go to hospital to prevent a stroke or get some medicine to prevent the stroke?
Yes, it's getting in the in 3 hours, included 3 hours. We get in the some streptokinase or any other TPA drug in the hospital for atrial fibrillation or something.
Okay. One more question has popped in. If maybe someone gets a stroke, is there potential for a stroke to recur? Maybe 2 or 3 times. Can you get consecutive strokes?
Sorry, I don't understand.
If you maybe you have a stroke maybe today, is there a chance for someone to get a stroke multiple times?
Multiple times stroke.
Yes.
Yes. We get research some in the especially in the heart diseases. Someone heart disease is coming getting the for childish in the some for foramen in the heart, but it's not aware of the in the adults time. We get very good in checking the heart problem, the recurrent problem is the stroke.
Okay. Maybe you can just tell us a little bit more on the different types of strokes we have and how severe some strokes are as compared to others.
Mhm. As the difference of stroke, or especially the ischemic stroke, is related to higher cholesterol and diabetes and hypertension. But the hemorrhagic stroke is related for every time is just hypertension, especially.
Okay, thank you. Maybe what are some of the things that a family or the relatives or close persons should do or should act towards maybe if a family member or a close friend has had a stroke? What are some of the support things they can do?
Mhm. As the family history is very important because of some of the diseases, especially in the higher cholesterol levels, in the familial is, genetic factors and the familial. But the other hand, especially in the hypertension, is coming from the familial transmitted for the genetic.
Okay. Um, is there any first aid that's people around you can give when someone is experiencing a stroke?
Mhm. Fasting.
First
Yes.
aid, yeah.
Yeah.
Are there some things that someone can do to help someone who's experiencing a stroke before they take them to hospital?
Yes. We getting in the airway is normal breathing. After then go to hospital. There is no emerge.
Okay, so just make sure that the patient is breathing and the airway is open and then
Yes.
rush them
Yes.
over to hospital. Okay,
Yes.
thank you so much for that. Maybe we can switch gears a little bit. What technology do we have at Liv Hospital as a center of excellence for stroke treatment and management?
To all new technology in we have it in the Liv Hospital and the coming in the hospital in the stroke patients in the first hour or 3 hours and 4 hours, and after that we getting all of the imaging method CT or MRI or angiography we have, and after the stroke, rehabilitation for robotic rehabilitation also we have.
Okay, thank you so much for that insight. Uh, we are almost winding up the session, but I just have like 2 or 3 more questions coming in, Professor. Someone is asking, how can you tell whether this drooping face is a sign of Bell's palsy or a sign of stroke?
Is the Bell's palsy is the peripheral problem. It's not related to brain or central problem. Is after the brain, the facial nerve in the, coming to face and affected to, out of ear, but it's not related to central problem, the before brain. But the
Okay.
other hand, the other facial palsy is affected just the mood. There is no other facial part.
Okay, thank you so much. You mentioned something about stroke affecting some ethnicities more than others. So maybe you can mention some of the ethnicities that are more prone to stroke. And then maybe does that also differ across men and women and across different age groups, maybe to younger people, older people, and middle-aged people?
Yes, ethnicity is important, but the ethnicity is the show us that some of the black people have the higher blood pressure than the other one. Is the related stroke risk for the especially is the higher hypertension for this and some race is the genetic problem for the blood clotting is the have before the is the risk of the stroke.
Okay. If someone maybe I know a lot of people in our audience would like to know this. Um, how quick or how well can you recover after you have suffered a stroke? Does that mean maybe lifetime impairment, or will you gain full recovery after you've had a stroke?
Yes, well, some of the strokes is the I said before is the TIA, transient ischemic attack. It's the spontaneous recovery in a 1 hour. But the other hand, if you the progressive stroke, because of this, we as soon as possible go to hospital in the stroke patient.
Okay. Um, foods to avoid, maybe. Food to avoid and drinks to avoid, so that we can avoid uh, experiencing stroke.
Food
Yeah, what are some of the foods that we should avoid?
should avoid. Okay. Maybe produced food we aware. For example, packages in the, for example, sausages or any other boxing food. Be aware. And the other, the high cholesterol, unsaturated some of the cholesterol included the margarines or any other food is beware.
Okay, so essentially we should avoid foods with high cholesterol, packaged foods, and a lot of processed foods.
Yes, processed food, yes, especially.
Okay, yeah, guys, you've had it. Go to the market for your food and not to the supermarket. And yeah, I guess we're about to close.
Beware this supermarket. You go to bazaar or local bazaar.
Yes, yes, go to the local bazaars. Um, I guess we are about to close in the session. I'm about to hand over, but maybe we can just have a few have a few more sessions. Um, Professor, in your experience as a doctor, um, as time goes on, you've had over 30 years experience, close to 30 years experience, or over 30 years experience as a medical practitioner. Um, is the prevalence of stroke getting more and more each year, or is it getting less? And yeah, your point of view as a medical practitioner.
Actually, is nowadays is very higher stressful for the actually current days, and we are reduced to stressful and to good sleep and good food and getting sports. It's
Okay,
very
so
important.
yeah, so we get a lot of rest, reduce stress, and eat good food. Maybe we can recommend exercise as well.
Yes, also is just for the aerobic exercise, 1 hour outside walking. It's enough. There is you don't have to go to gym or any other place. We go to outside and do walking 1 hour in the outside. It's enough for health for protect the stroke.
Okay, thank you so much. And as you walk out, maybe you can attach your wearable device. Um, Professor, one last question. If someone, how should you care to someone who has undergone a stroke at home after they've come from the hospital? What are some of the things that you should do to take care of someone of a recovering patient from stroke? From stroke.
You have to just have the one thing. You're getting breath, the patient, but there is no other thing. It's getting the
Already,
hospital.
already. Okay, thank you so much, Professor.
Welcome.
Our Q&A session is over. I hope, guys, you've had all your questions answered. We will have an email dropped to you guys after this, answering most of the questions that Professor has addressed as well. So I'll hand this over to Eva, and thank you so much, Professor, for the time and for the education you've given us.
Thank you. Thank you very much. See you. Bye bye.
Thank you so much, Professor. Thank you, Chebe, and also thank you for everyone who's joined us. I think for me, my key takeaway is that I need to make sure that my stress levels are low.
Yes.
I also need to eat very well and make sure that at all times I'm active, my cholesterol is down, I'm always checking my health, to make sure that my stroke probability levels are low. And I hope that you've also learned the same. Now, as we told you earlier, we are a medical facilitation company. And in case you'd like to reach out to the professor or to the doctor at Liv Hospital, please reach out to us. Our contact details are in the screen. As we speak, reach out to us. We're going to make the arrangement and also facilitate that whole process for you. I'm not sure if you have any question before I can close the session for today.
Thank you.
Thank you so much.
Bye bye.
Okay. If there are no further questions, thank you. We are going to do a follow-up after this, so please look forward to hearing from us. Have a good evening.